My name is Frits Wijburg. I'm a pediatrician, and I'm a pediatrician specialized in metabolic diseases, inborn errors of metabolism. I work in the Academic Medical Center in Amsterdam, and I am involved in a lot of inborn errors of metabolism, but with a special focus, and this focus is on the lysosomal storage diseases. And within the lysosomal storage diseases, again a special focus on the mucopolysaccharidosis, which is what we're here for at this conference.
Of course,
yeah.
Today's the day. Could you summarize for us, what was your talk about?
My talk was about the studies that have been done worldwide, also in the Netherlands, on the use of genistein. And genistein is a substance which is in natural plants and food, especially in soybeans. And we know that this genistein, this special substance, may have an effect on mucopolysaccharidosis. In this way that in mucopolysaccharidosis, the basic problem is that glycosaminoglycans, a substance we all have in our bodies, cannot be broken down, so it accumulates. Giving genistein may reduce the amount of genistein that accumulates because it slightly inhibits the synthesis of the glycosaminoglycans. So by giving genistein to patients with mucopolysaccharidosis, we hope to make a new balance between synthesis, which we decrease with genistein, and degradation, which is impaired because of the disease. And so we hope with genistein to improve the disease in patients. There have been studies in cultured skin cells showing that it works in cultured skin cells. Studies have been done in patients, but it's difficult to do real good studies in mucopolysaccharidosis. The reason for this is it's rare. It's difficult to have enough patients. Patients differ. You have severely affected patients, you have more mildly affected patients. So what we were able to do over the last couple of years was a specially designed study in which we used genistein as the drug, but we also gave patients for a period a placebo, so a non-active substance. And then you can compare, are there any differences? And I'm really happy to say that we were able to show that if patients get this genistein, the amount of glycosaminoglycan, the storage material, in urine and blood decreases. So there is biochemical effect of this treatment. It's very difficult to show that it also, and that's of course the most important part, that it also has a clinical effect. And to do this, new studies are needed.
What do you think of the conference so far?
Oh yes, I'm very happy with how all things are going. The venue is great where we are. The weather is great, which is for the Netherlands, as you know, not always the case. But most importantly, we are here together. And what makes this conference unique is that we are here together with patients, families, friends, and with colleagues from all over the world. And one of the things I always repeat, what I truly believe is we all want to advance care and cure for these patients. The doctors cannot do this alone. The basic scientists cannot do this alone. The families cannot do it alone. We can only do it by working together. And this unique symposium combines all these three different groups. There are nurses, there are physical therapists, there are orthopedic surgeons. We all need to be in this together to be able to really make a difference. And we all want to make a difference. So I'm sure that a conference like this will again be a step in the direction where we want to go, cure and care for these patients.